Now, let's move a little towards Western India and let's talk about two of the key states which have few key problem cities with high number of cases. But these two states are actually relatively better off today than they were earlier. So, unlike the southern India, where the problem seems to have become a little more grave now, and they seem to be doing much better in around mid-May. In Maharashtra and Gujarat, that's not the picture. So let's talk about Maharashtra and let's talk about Gujarat and get you those details. And I actually first up want to pull up Gujarat for you. Gujarat actually saw, viewers, a turnaround between 25th of May and 30th of May. Now, this is much after the 17th May lockdown 4th version that had kicked in, which had significant amount of relaxations coming in. That also did not have an impact on their cases, number of cases, and the active cases rate actually went down and the recovered percentage went up. And since then, since about 3rd of June, since the time that we've actually come into Unlock India phase, they seem to be holding on to those levels. The recovery rate seems to be stable. The active case rate also seems to be stable. So it's a very, very interesting trend that we are picking up as far as Gujarat is concerned. The trend is upward for recovery to confirmed ratio. That's what it indicates. And if this continues, we will have to see whether the active case rates then begins to fall. This is as far as Gujarat is concerned. That's a state where the authorities very clearly started demarking people who are high-risk contacts, shopkeepers, vendors, delivery guys, newspaper guys, and started testing them. So that was a very specific policy that Gujarat implemented, especially in Ahmedabad. And they went and they found out who were the infected people in these zones. The minute you clamp down and isolate those people, your rate of infection immediately comes down. That's one thing that has worked for Gujarat. We will have our experts telling you a bit more in just a bit. Let's also get you the details from Maharashtra. Maharashtra, since the beginning, has been a bit of a challenge. Maharashtra was a state that was literally on top of the charts, but now, despite how the southern states are doing in West India, Maharashtra seems to be seeing some amount of relief coming in. I don't even have to say to you, you look at that chart and you will see that there is a very distinct difference in what's happening post 27th of May, where the active case rate came down a little and then has stabilized at that level. Similarly, the recovery rate went up, improved, and then has stabilized. Now, keep in mind, viewers, that these charts that we are showing to you and this analysis that is being done is on the basis of the data that the government gives us. It's on the basis of the number of active cases, total number of cases, total number of recoveries, how many people are getting discharged, what the government shares with us. So this is what the data shows. Let's also say good evening to the panelists who are joining us. I have Ajay Umat, Senior Editor for Nav Gujarat Samay with us this evening, and Dr. Subhash Salunke, a Senior Advisor to the Public Health Foundation of India for Delhi and a member of the COVID Task Force with us this evening. Let me go across to Vinay Tiwari first, and Vinay, let's speak about Maharashtra first, the state that we've closely tracked, and the numbers and the charts do look a little interesting.
They do. And look, I mean, this is a state where we both live. So obviously, we looked at it far more closely than possibly other states as well, got affected by that as well. But Maharashtra was our Indian team of the 90s. They started off very poorly, very, very poorly. In fact, I think Bombay was looking like a case situation where things had gone almost out of control. And to add to the misery of Maharashtra government, Pune was equally bad. And I think in the next hour, Tanvi, when we go to the cities, we'll see that Maharashtra's graph has improved significantly, principally also because Pune has now come under control. It was a situation as bad as possibly Bombay was 3 weeks ago. That seems to have recovered a little bit. But outside of the two big cities that we have, the state has been able to manage it fairly well. And that, I think, is the best thing. I mean, the graph very clearly shows you how both the lines are almost now converging. And when that x-axis gets formed and the number of recovery cases, significantly overtake those who are active cases, Maharashtra can slightly breathe easy. But I think it will serve Maharashtra very well to look at the examples of the states in the south, because the minute you start breathing easy and you think the virus has gone away, it can come back. And I think that's the biggest lesson that other states can draw from each other, that this is not something that's just going to go away. It's not like a game where you hit the final delivery and then the match is over. It's not over. It's only that right now you've been able to manage it. You got to build on it. Keep doing the containment and isolation strategies strictly, and follow social distancing strictly, because it can easily come back, and a second wave can easily come back, as you're seeing possibly in Kerala, Tanvi.
Yes, absolutely. In fact, let me just look at the last few days data as well. June 5th, Maharashtra had about 77,793 cases. In June 6th, it was about 80,029 cases. June 7th, roughly around 83,000, 82,968 cases. June 8th, 85,975. And June 9th, 88,000. So even here, if you see, it's gradually being the active cases are going up, and it's much better in terms of what we saw in the month of May and the kind of cases that we're seeing in the month of May. But keep in mind, viewers, this can also be a little different from many of the other places, because in Maharashtra, in the key cities of Mumbai and Pune, the relaxations are not as much as they are for some of the other cities and states. So that's something that we have to look at. But let me quickly also bring in Mr. Ajay Umat, senior editor of Nav Gujarat Samay, and understand, what Gujarat is doing that seems to be working for them. Mr. Umat, give us some insights. How has Gujarat fought this battle?
Look, if you see the scenario in Gujarat, after Maharashtra and Tamil Nadu, Gujarat is at number 3 position. The problem in Gujarat is that, compared to Indian average, the mortality rate is highest in Gujarat. It is almost 6.78. Compared to Maharashtra, it is hardly 3%, and in Tamil Nadu, it is less than 1%. So major problem in Gujarat is that, number of people dying at civil hospital in Ahmedabad is highest. If you see, I was reading a very interesting paper written by Professor Mavlankar, who is an expert in preventive social medicine. He says that, out of 730 districts, there are 20 districts which has 70% cases of corona in India. And if you study Gujarat, 80% cases are from Baroda, Surat, and Ahmedabad city only. And out of this 80% cases which is in Gujarat, 70% mortality took place in Ahmedabad city only. So major problem that government of Gujarat is facing today, though our recovery rate has improved. Our recovery rate has improved significantly, but mortality rate has also, has gone high, and that is a matter of worry. And that was the reason that, Mr. Amit Shah, Home Minister, has sent a team of AIMS, Professor Guleria and others had come here, but they could not find out what is wrong with the medical protocol, why mortality rate is going very, very high. On the other side, Gujarat has, Ahmedabad city has entered into a herd immunity level. Cases are going down in the eastern side, that is, walled city in Ahmedabad, but it is increasing after lockdown on the western side of Ahmedabad. So it shows that, number of cases are going down, down and down in eastern part of Ahmedabad. But on this side of the cities, that new city, it is going significantly high. And that is also a matter of worry for Ahmedabad city, because, medical infrastructure, number of ventilators are now not available. Oxygen bed is also, in scarcity. And private hospitals, they also are not in a position to provide beds. And another thing, despite High Court order, government is not encouraging private testing, which is a matter of worry in Ahmedabad and in Gujarat also.
Okay, so private testing is still a matter of concern, but in Gujarat, what we have seen is that the numbers spiked after about 700 people, were found positive, who were people who were high-risk contacts, and those people who are coming in touch with large number of others, fruit sellers and vegetable vendors and shopkeepers or delivery guys. Yes, I mean, I don't like to use that term. I know the government uses it, but I hope it doesn't attach a stigma to any of these people because they are being called super spreaders. But do you think, Mr. Umar, that that strategy did work? Because that's not something that many states have done.
No, that strategy has worked. Government of Gujarat has done a wonderful job by, imposing a very strong lockdown in Ahmedabad city. And for 7 consecutive days, they have continued to do screening of vendors, particularly these hawkers, vegetable vendors, flower walas, fruit walas, and others. And they did screening of almost 35,000 such vendors. And then they issued them certificates. And those who had symptomatic conditions, they were taken to COVID care centers. And those who were found positive, almost 700 of them, were treated at civil hospital and SVP hospital in Ahmedabad. So that was a wonderful job done by, government of Gujarat and Ahmedabad Municipal Corporation jointly. And that was one of the reasons that, now we have recovery rate has improved significantly. But my only worry is that, at the same time, mortality rate compared to Maharashtra and Tamil Nadu, it is very high in Ahmedabad, and they need to do some corrective measures there also.
Okay. All right. So that's what the government needs to do as far as Gujarat and specifically the city of Ahmedabad is concerned. There is also another problem, but I'll come to you in just a bit, Mr. Raja Umar, on the healthcare infrastructure part. Let's also come back to the conversation about Maharashtra. And Dr. Salunke is with me. Dr. Salunke, as far as Maharashtra is concerned, it's been a tough battle from day one. Mumbai itself adds to the biggest of the problems for Maharashtra in terms of large number of cases, but we are seeing some amount of slowing down. Would you agree, and why is that happening finally?
I fully agree with you. As a matter of fact, Maharashtra is a peculiar and special situation because of the fact that practically due to initiation of the outbreak or pandemic, the dose of the virus, the fact remains that the people in such a large number first were they created a kind of a situation in Mumbai, and so Mumbai cannot be compared with any other city in India. But you are absolutely right. The concerted efforts on the part of government of Maharashtra, Mumbai Municipal Corporation, and other corporations like Pune, they are now yielding results. And what you are seeing, the definite bridging of the gap between the active cases and recovery. But let me tell you very frankly, as an epidemiologist, and Mr. Tiwari also, your editor also commented on that. I mean, let's not give a lot of importance to this, recovery rate and this rate and that rate. The most important part is going to be how many of these cases are being saved by us, and point that is being repeatedly made as far as Gujarat is concerned is the one I would like to give a lot of importance. Are we in position to design and define our health system in such a way that we are going to save maximum number of lives? Cases are going to increase. Lot of cases who are going to be pre-symptomatic or symptomatic milder cases, recovery rate is going to improve, but it's not a guaranteed. Like we have seen in southern India, recovery rate can cross the active cases and come down again. So do not give lot of importance to the number of cases. Let us now give importance to what facilities we are making to ensure that the lives are saved. Let me assure you and let me assure viewers through you, we are going to get fluctuations in many states. We can't name every state, but fluctuations will occur. We will see declining rates of the newer cases in southern India, including Maharashtra, but you will see increase in cases in eastern and northern India. Are we as a nation prepared for that? That is the major question. Number two, are we going to ensure that we are going to fight this we are going to fight this battle for next few months. It's not going to be June, July or August. It could be even up to December, Jan, who knows, even next year. How are we going to ensure that comorbid patients, high-risk patients or high-risk people are saved? And that is where Government of Maharashtra and these two municipal corporations have taken a very proactive step, and I have to appreciate the entire teamwork of these two municipal corporations, which I have myself seen it. The way containment measures, in spite of so many challenges, Dharavi management is a special case in itself. So we have been able to, Municipal Corporation of Mumbai has been able to manage it now. Last 3-4 days, no deaths. So these are few indicators which are showing that we are on a right path, and we need to continue with precaution, with caution.
In fact, Dr. Salunke, I wanted to ask you on Dharavi specifically. How we handle Dharavi, Dr. Salunke, can become a case study for many other places, because it's the
Dharavi is a
most
case
densely
study.
populated slum area, such large population. But look at the numbers we are reporting now. At one point we were reporting 50, 70, 80 cases every day, a dozen deaths every day, and now a dozen cases every day.
That's right.
What
it was more
there,
than 100. It was
Dr.
more than 100, Please let us compliment and congratulate our Municipal Corporation Mumbai's team. They have done a good job. Their ward level officers, their doctors, the nurses, the ashas, the volunteers, and most important, Dharavi people. Let's not forget. See, let us not take credit by the health system or municipal administration per se in totality. Let us give credit to a teamwork, including society. Unless they themselves want to save them, how can you think about any public health emergency without participation of the community and people to succeed? It's not possible. So if Dharavi has succeeded, credit goes to obviously dedicated staff of Mumbai Municipal Corporation, dedicated people of Dharavi themselves, and ready to listen to the challenges of this epidemic. So it's a combination, and I feel we need to learn from Dharavi even in other areas. On same lines, look at the Pune Municipal Corporation. Look at the areas of the Bhawanipet, look at the areas in Pune which were so challenging just 3-4 weeks back. We ourselves were worried. But I feel we have to appreciate the concerted effort on the part of the team. Like say, Government of Maharashtra identified 4-5 senior level officers. Now they are focusing on specific activities. They are monitoring it not daily but hourly basis. We monitor even with the hospitals, in Sassoon hospitals, in other hospitals, in KEM. I know there are a lot of criticism of the kind of an non-availability of the bed, non-availability of the ambulances in time. But please note, we are dealing with the population of size of Mumbai, and total MMR is 2 crore plus population. So I think let us appreciate that comparatively in a short span of time, the systems are now in place, people are cooperating in spite of relaxation, and this is very encouraging. I'm so happy that in spite of the relaxation or unlocking of this entire system, now it is already 8 days. I'll be more keenly worried for another 8 days, and after 14-15 days, if there is not going to be spurt in the cases, I know we are in a right direction.
Right.
And Government of Maharashtra, right at the top level, whether Chief Minister, Health Minister, here our Deputy Chief Minister is, taking review every week. I'm attending some of these reviews, and I'm fairly impressed with the political commitment, the bureaucratic commitment, and the teamwork, and most importantly, participation of the people themselves.
Well, we are still seeing a stricter level of lockdown that continues in Mumbai and Pune. We still have to come to a point like other cities where we start opening up more. And Dr. Salunke, I have a feeling that the challenge will become tougher then, especially if we don't get our health infrastructure in place. We still don't have enough ICU beds. Most of them are occupied, or even otherwise. Hospitals are being made. Vinay, you wanted to make a point before we wrap up this conversation?
No, look, Dr. Salunke and I represent different professions, and we usually tend to see the glass half empty and not exactly the glass half full. I'm not saying that the glass may not be half full, it may be, but let's be honest. The BMC and the Maharashtra government started very badly. The BMC was in a mess, and because they were in a mess, the whole leadership got replaced midway into this war. The good news is that the new leadership that has come in and the Maharashtra government has reacted to criticism probably a little more positively, and I think that's a good sign. They got really criticized for the way they were handling it possibly in May, and the good sign is that they seem to have learned those lessons and are now moving towards fixing it. So that way is good. But to suggest that they were all doing very well from the start was not the case at all. I mean, both Mumbai and Pune were in a very bad shape, and we know, and our reporters who were out in the field know, that in many cases the bureaucracy was not even talking to each other, even though they were sitting in probably a 2 square kilometer area. I mean, places like Thane, Virar or Vasai, we had problems. So good that they've recovered, and I'm happy that they're now fixing and trying to contain this problem in a better way than they did at the start.
All right, completely out of time. Thank you so much for our panelists for joining us with their insights as far as Gujarat and Maharashtra are concerned, viewers. And this is what it looks like. The southern states that were doing much, much better. And at one point in May, it looked like they may, finally be emerging out of it, hitting their peak, and then crossing to the other side where it's only recoveries and improvement. But perhaps because of the fact that we let our guard down, people started to come out, people forgot about social distancing, perhaps also because of the fact that the government's policies were not strict enough, or that they were not testing enough and isolating enough. There is a bit of a challenge that continues. Also the fact that there was a lot of travel involved. Lots of people were brought in from abroad. People were allowed to travel within the country, and so the numbers have changed now. But as far as Western India is concerned, both Gujarat and Maharashtra seem to be finally getting a grip on the problem in these states in terms of large number of cases. Both of these states have been in the top 3 at one point in our country, and now they're beginning to at least get a grip on the number of cases, and the recoveries are going up. Too soon to say. We will keep a close track and keep getting you these analysis.